Dear students, Assalamu alaikum. In the previous lecture, we studied that how the lymphocytes they are pre-processed in thymus in case of T lymphocytes, and in the bone marrow and the fetal liver in case of B lymphocytes, and then they are activated. So today we'll be studying the humoral immunity, and for the as you know that the humoral immunity is the function of the B lymphocytes, and for B lymphocytes to perform their function, they have first to be activated. So the macrophages have a very important role in the activation of the B lymphocytes. They directly activate the B lymphocytes, and they can also activate the T lymphocytes, and out of the T lymphocyte, these are the helper T cells which can activate the B lymphocytes. So the B lymphocytes they can directly be activated by the macrophages or by the T helper cells. So after the B lymphocytes are activated, the next step is the formation of the antibodies. Now what happens is that those B lymphocytes which are specific for the antigen, they immediately are enlarged, and then they take on the appearance of lymphoblasts, that is, that they become lymphoblasts. So the next step is the formation of lymphoblasts from the B lymphocytes once they are activated. Now, some of the lymphoblasts, they are further differentiated to form the plasmablasts, which are precursors of the plasma cells. Now, the plasmablasts, they begin to divide, and they give a total population of about 500 cells in 4 days from each original plasma blast. Now it's the mature plasma cell which then produces the gamma globulin antibodies at an extremely rapid rate, and this is about 2000 molecules per second for each plasma cell. Then these antibodies they are secreted in the lymph, and they are carried to the circulating blood. Now this is known as the primary response, and to differentiate it from the secondary response, which is the formation of basically the memory cells. So the memory cells, they are formed, and they then carry out the secondary response. So how these memory cells are formed, what happens is a few of the lymphoblasts formed by the activation of a clone of B lymphocytes, they do not form plasma cells as the majority of other lymphoblasts are doing, but some of the lymphoblasts they do not form the plasma cells. Rather, they form new B lymphocytes similar to those of the original clone. So they form a population which is very similar to the original parent cell. Now these newly formed clone cells, they circulate throughout the body to populate all the lymphoid tissue. and then they remain dormant until they're once again activated by the same antigen. Now, these lymphocytes, B lymphocytes, actually, they are called the memory cells. And when there is subsequent exposure to the same antigen, this will cause a much more rapid and potent antibody response the second time. So when these B lymphocytes, they are exposed to the same antigen the second time, then they undergo all those stages of plasma, lymphoblasts and plasmablasts, and formation of plasma cells, formation of antibodies. So this time the reaction or the response is much more rapid and more potent the second time, and this is known as the secondary response. Now let's have a look at this diagram, which shows the primary response and the secondary response. Now it shows the differences between the primary response for the formation of antibodies that occurs on the first exposure to a specific antigen, and the secondary response that occurs of the secondary exposure to the same antigen. Now note, after delay of about 1 week, there is this appearance of the primary response. It's not very potent and it has a short life. Now in contrast, the secondary response begins rapidly, much more rapidly, after exposure to the antigen, often within hours, and this is much more potent and forms antibodies for many months rather than for only a few weeks. So this is the idea, this is the principle behind giving 2 shots of a vaccine. So first shot is the primary response, and then when the second shot is given, there's much more rapid and potent response, and the antibodies, and they remain for many months. So you can study this diagram from your textbook. And now let's move on to the nature of the antibodies. That is, what is the structure of these antibodies? Antibodies, they are the gamma globulin fraction of the plasma proteins, and they are called immunoglobulins. They are the gamma globulin fraction of the plasma proteins. Now, all the immunoglobulins, they are composed of combinations of light and heavy polypeptide chains, and mostly they are a combination of 2 light and 2 heavy chains, but we do have heavier antibodies also. So in all immunoglobulins, each heavy chain is paralleled by a light chain at one of its ends, thus forming a heavy light chain pair. So there are always at least 2 and as many as 10 such pairs in each immunoglobulin. Now this figure shows a structure of the immunoglobulin, showing the variable portion, and the remainder of the chain is the constant portion. Now keep in mind that the variable portion is different for each specific antibody, and it is this portion that basically attaches to a specific type of antigen. On the other hand, the constant portion of the antibody determines other properties of the antibody. For example, its diffusivity in the tissues, its adherence to the specific structures within the tissues, its attachment to the complement complex. And it also determines the ease with which the antibodies may pass through the membranes, and maybe other biological properties of the antibodies. So the variable portion basically is the specific portion for a specific antigen. It is the portion that binds the antigen, and the constant portion has other properties, as I have just mentioned. Now, there are 5 general classes of the antibodies, respectively called IgM, IgG, IgA, IgD, and IgE. So there are 5 general classes, and each have their specific functions. Now, let's study the mechanism of action of antibodies. How do they act? How they respond to the different antigens. So remember, basically, there are 2 main mechanisms of action of antibodies. Number 1 is the by direct attack on the invader cell or foreign cell or the microorganism, and number 2 is by activation of the complement system. So first we will study the direct method or the direct action of antibodies. Now, the direct action of antibodies involves 4 main ways or methods, naming agglutination, precipitation, neutralization, and lysis. Now, in agglutination, multiple large particles with antigens on their surfaces, such as bacteria, they're bound together into a clump. So the antibodies cause the clumping of the antigens. The second is precipitation, in which the molecular complex of the soluble antigen along with the antibody is so large that it becomes insoluble, and then it is precipitated in the solution. Third is the neutralization, in which the antibodies they cover the toxic sites of the antigenic agent. Third, lastly, the lysis. What happens in lysis is that some antibodies they are actually capable of directly attacking the membranes of the bacteria or the foreign agents, and they can cause rupture of the agent. So now this function is basically mostly carried out by the complement system, lysis, but the antibodies they can also directly cause lysis of the foreign agent. So these are 4 methods by which the antibodies can act directly. The second important mechanism is the activation of the complement system. Now, a complement is a collective term that describes a system of about 20 proteins, plasma proteins, and mostly these are precursors of enzymes. Now the basic the principal proteins in this system are about 11 proteins designated C1, 2, 3, 4, 5, 6, 7, 8, 9, protein B and protein D. Now they are present normally among the plasma proteins, and they are these enzyme precursors, they are normally inactive, but they can be activated by the so-called classical pathway. Now, the classical pathway is basically initiated by the antigen antibody complex. Now you can see in this figure that when an antibody binds with an antigen at a specific reactive site on the constant portion of the antibody becomes uncovered, and this in turn binds directly with the C1 molecule of the complement system. So after that, there's a cascade of reactions that take place, and beginning with the activation of the proenzyme C1. Now the C1 it activates the C4 and C2, and leading to the formation of C42 and C4A. Now C42 it acts on C3 and C5, leading to the formation of C3b and C3a, as well as C5b and C5a. And C5b acts on C6 and 7 proteins, enzyme precursors, leading to the formation of C5b67. Now this acts on the C8 and C9 proteins, and it leads to the formation of the C5b6789. So this is called the lytic complex, and this causes basically lysis of the cells. Now you can see the arrows on your right hand side showing that some of the products they can cause specific effects. So the specific effects of the classical pathway can be summarized as opsonization and phagocytosis. So one of the effects of classical pathway is opsonization and phagocytosis. So C3b product, it strongly activates phagocytosis by both the neutrophils and macrophages. The other effect is lysis, and as we have just seen that the lytic complex, which is basically C5b6789, it has a direct effect of rupturing the cell membranes of the bacteria or other foreign organisms. So lysis is another effect of the activation of the classical pathway by which the antibodies act. And then there is agglutination, and the complement products, they can also change the surfaces of the invading organisms, and leading to their stickiness to each other, promoting the agglutination. Then there is neutralization of the viruses, and what happens is that the complement enzymes and other complement products, they can attack the structure of some viruses and can cause them to become non-virulent. And chemotaxis is caused by the C5a fragment, and this causes the chemotaxis of the neutrophils and the macrophages to the affected area, inflamed area. Then there is activation of mast cells and the basophils. So the fragments which are formed by the classical pathway, like C3a, C4a and C5a, they activate mast cells and basophils to cause local tissue reactions that help in inactivating or immobilizing the antigenic agent. So activation of mast cells and basophils is another effect. Now lastly, there is inflammatory effects caused by these products of the activation of the complement system, there's increased blood flow, there's increased capillary leakage of the proteins, and increased coagulation of the fluid proteins. So, to summarize, the effects of the activation of the classical pathway are: number one, opsonization and phagocytosis, lysis, agglutination, neutralization of the viruses, chemotaxis, and the activation of the mast cells and basophils, and the inflammatory effects. So I'll stop here, and inshallah we'll continue with the cell-mediated immunity in the next lecture.